Hi everyone, welcome to ATP Live on Monday. And today's a special one because we're having a session with our gynecologist, Dr. Jumoke Ogunro. So I'm just waiting for Dr. Jumoke to join me and then we can start. This is a session for you mothers. Just feel free to ask your questions and post it and then we can take it. All right, I'm just going to set up the watch party. I'm still waiting for everybody to join me. Okay, I hope I'm live because I can't see anybody now. Okay. Welcome everyone who is joining us. Just trying to set up on the watch party for those on the Facebook group. Looking for Dr. Jumoke. Am I not live? Am I not live? Okay, I think Dr. Jumoke is here. Okay, welcome everyone. I guess we are good to go. Waiting for Dr. Jumoke to join me. All right. And welcome. I can see a lot of people, some people are on Facebook already, but I'm not seeing anybody on Instagram yet. Okay, so like it's going to be a Facebook affair today. Okay, just a minute. Dr. Jubaka, I can't see you. You're not yet joining. I don't know whether there's a problem with the internet. Okay. Okay, I think I'm just going to go off and start all over again. I'm not sure what's happening. Oh no, okay, I'm on the wrong. Oh, okay, sorry, it's my fault. I think I'm on the wrong one. Okay, yeah, I think we're back. Just waiting for Dr. Jabak to join me. Thank you, everyone. So today is a live one special for those for maternal health issues. So feel free to drop your maternal health question. This is for the mothers. Oh my goodness. Okay, yeah, I see Dr. Jumoke. Okay, yeah, welcome everyone. Sorry for the initial kind of issues that we had. Welcome to ATP Live, and today is a special one because I'm going to be joined by Dr. Jumoke, who I can see already joining us. Hi, Dr. Jumoke.
How are you?
I'm fine. Is it possible for you to face the light direction because we can see you, but you're very dark. Yes, 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 that's better. Yes, yes, we can see you better. Okay, thank you so much for joining me. So, thank you, Dr. Jumoke. Let me just do your introduction while people are still joining. And so today is ATP Live special, and I know you guys are used to asking health questions about children. And but today I've decided to bring in a consultant gynecologist and obstetrician who is also an author of the book Beyond 9 Months, so which talks about antenatal care and care of the newborns. And so today she's going to be answering questions about your own health as mothers. So maternal health issues, that's what we're going to be dealing with today. So please try and ask questions that have to do with your health, about pregnancy, about family planning, anything that has to do with gynecology or women health issues, because we don't get to have opportunity to ask the gynecologists, obstetricians health questions. So this is your own opportunity. So if you have health questions that regard the children for today, I would just say just post it on our Facebook group and we will answer that for you afterwards. So, but try and let's maximize having a special guest, which is Dr. Jumoke. So, if you are not having health issues, questions that have to do with health issues as regards the mother, I'm not going to take your question. I will just say please pass it to our Facebook group so that we can have Dr. Jumoke have enough time to do justice to questions that has to do with you as the mother. So you're all welcome. Feel free to share the video, invite your friends and family, and you can watch it on our Facebook group, you can watch it on the watch party, you can watch it on our page, you can watch it on Instagram, you can watch it on YouTube. So wherever platform you are able to drop your questions and I'll try and see how we can answer them. So Dr. Jumoke, you are welcome.
Thank you, Jane.
So yeah, nice to have you here. Yes. So do you want to say something before we start taking the question?
Well, thank you for having me. As always, we're here to answer all your questions. So today, we're expectant that we'll be able to sort out some of the burning issues or concerns you may have concerning your health. Okay. So the ball is in your court.
All right. So we do get a lot of questions about maternal health issues. So it's a good thing. I just want to put something up to let people know that this is ATP Live on maternal health issues. How do I pin this comment? Shemilore. What were you doing? Sorry for that. Okay. All right. So I think I'm not able to pin the comment. I don't know how to do it again. I've forgotten. All right. So I'm just going to start taking the questions. So usually what I do, I'll take a few on the Facebook group. I mean on the Instagram, then I'll go to Facebook and vice versa. So just be patient with us. Okay, so thank you everybody who has joined us. I can see TFK Bags is having question about your 9-month-old baby. So for today, please post your health issues about your baby on the Facebook group and we will answer them later. I want to answer questions about mother's health. So good. Bean Tochi is asking, please, is it right to get pregnant with diastasis recti? And yeah, I'm sure Dr. Jumoke, you get that?
Yes.
Okay. Can you shift your camera down a little bit? Yeah, better so that we can see you. Better. Yes, so that we can see your face.
So it's just it's not a contraindication to getting pregnant. That's the truth. You can get pregnant with a hernia. In fact, sometimes people would advise you not to repair the hernia until you have finished having all your children. Because the thing about it is that we know with pregnancy, as the pregnancy advances, the uterus will stretch your muscles again. And so when you repair it, the tendency for you to have a repeat repair will be higher with subsequent pregnancy. So it's not a contraindication to getting pregnant, or it's not that, oh, when you have a hernia you cannot get pregnant. However, it's very important where you register who takes care of you. So if you have a doctor, for instance, that knows that there are certain things you are going to how will I say, that they are going to watch out for. The most important thing is to make sure that the intestine does not come out, and then it does not get strangulated, as you put it. And remember, as the pregnant uterus continues to get higher, the intestines are actually displaced. So you can get pregnant. And in fact, we always advise that for you to have your final repair, you have had all your babies, then you can now have a repair of the hernia, so you can get pregnant.
So is it safe to say that such mothers should better register with you, the specialist, the gynecologist, obstetrician, rather than with general midwives or general practitioners?
Most definitely, you get registered with a specialist, and also a hospital that is a multi-specialist hospital, if you know what I mean, where you can have access to the surgeon, because you could have intestinal obstruction or blockage as a result of the hernia anytime. So you want to make sure that you have all the specialists available wherever you register, just in case such a thing happens, they're able to intervene. So yes, that's important. It's not the one for traditional birth attendants or primary health care sector.
Okay, so I think Binto, you seem to be answering your question. You say, is it safe to carry pregnancy with that? Cyst recti? Is it quite serious with strangulation of the intestine? I think Dr. Jumoke has answered your question. It's not as if you can't have your pregnancy, but you really need to register with the specialist so that it's a multi-specialist hospital so that they can monitor you closely. All right, thank you. Queen Ban is saying, God will continue to reward you. Please, if you want to take the cervical cancer vaccine, what test can the person run, and what's the relationship between the HPV test and pap smear? I'm happy you asked this question because Dr. Jumoke already told me she would like to talk about cervical cancer, and so it's a good thing that somebody is actually asking, because we know when the February, where we celebrate Cancer Awareness Day. So it's a very good question. So I will just take your question one by one. You said that if you want to take the cervical cancer vaccine, what test must the person run? That's what you want, okay?
All right. So ideally, there's no test you should run. The cervical cancer vaccine is usually, we always advocate that young girls take it from 9 to 26. And this is because what cervical vaccine does is that it prevents certain types of HPV infection, which human papilloma virus, which is what is linked to 99% of the cervical cancer cases. So what you want to do is to prevent the infection in young girls before they become sexually active. All right. However, you find out that people from 27 to 45 can also take the cervical, they can take the vaccine. However, you know that it is not that beneficial to them. The reason, because they most likely would have been exposed to HPV infection before. However, some people in where the resources are there, you could do your HPV testing. All right. When you do the HPV testing and it is negative that you don't have the HPV infection, then they can counsel you to take the vaccine. However, if your HPV test comes out positive, then there's really no need of taking the vaccine or doing your routine pap smear. However, you know that the HPV vaccine takes care of certain types of HPV infections linked with cancer, but not all the types. For instance, the popular Cervarix just applies to in Nigeria, but we have one in the US that we call Gardasil 9 that takes care of more subtypes. But however, taking the vaccine does not knock out your routine cervical screening. So yes, you don't need any test per se to take the vaccine. However, we really target the young people before they have the HPV infection. But it's not to say that those people that have already been sexually active and above the age bracket of 27 cannot take it, but it is not as beneficial as if you took it earlier.
Okay, that's very, very important. So it's not as if those of us that are already past the age, because I know some of us at the time we were growing up, we don't have the vaccine. I mean, so they can still take it, but you are suggesting that they should be tested first. So is it that anybody that already has the who already has the HPV, are you saying that they can't take the vaccine anymore?
They can. But what I'm trying to say is that it's not as beneficial.
Oh, okay.
I remember that it's not as beneficial. I know that there are different subtypes. Okay, the most important, the Civarex takes care of the 16 and 18. What happens to the other ones, 31, 33, and other subtypes that have also been linked to cervical cancer?
Mm-hmm.
You know, it's not going to cover for it, but you can still take it, but just know. So you don't have the notion that, oh, I'm taking the vaccine, I'm covered. No, you still have to go ahead with your routine pap smear screening.
Okay, so which brings
it's not as beneficial.
Yeah, thank you, Dr. Jumoke. So she's not asking what is the relationship between the HPV test and the pap smear.
All right, so we have, when we're talking about cervical cancer prevention, there are different types of levels of prevention. There's the primary prevention where you want to just prevent the HPV infection, hence the need for the vaccine, and also people advocate lifestyle changes, limit your sexual partner, and prevent sexually transmitted infection by using the condom. Using barrier method when you probably have multiple sexual partners, or you don't have one sexual partner, you have multiple sexual partners. So the pap smear is a screening tool. All right, because we know that cervical cancer does not develop on its own. Mm-hmm. There are certain lesions, or there are certain developments that happens before it becomes cancer. So we call those kind of stages, we call them precancerous changes or precancerous lesions. They are not cancer. They are not cancerous. However, if you leave them untreated, they can develop into cancer. Hence, why we now do the screening. So the screening is to catch these lesions at that time when it is precancerous, it is not yet cancer, and you can easily treat it before it becomes cancerous. Okay, HPV testing just tells you, have I been exposed to HPV infection? That is what it does. So there are two different things. HPV testing will tell you, oh, you've had this HPV infection before, you've not had it before. But that does not mean, you can do the testing now, it's negative, okay, and then in another few years time you have it, and then that can predict. But when you have routine pap smear screening, just make sure that, okay, we can catch it early before it ever becomes cancer. So like I mentioned earlier, even having a vaccine does not prevent you or stop you from having your routine cervical screening. It doesn't.
Okay.
Because remember that those vaccines just prevent, so they cover some subtypes, they don't totally cover everything. It's better to also, in addition to the vaccine, have your routine pap smear.
So how often should we have our pap smear while we're still on that topic?
Well, we advocate 3 yearly, especially when you're in the reproductive age group. 3 yearly till you're about 65. Then if it now becomes, you've had, maybe in the previous 10 years, you've had negative results, then you can stop having it. But every 3 years, if it has been normal, then you have it. However, of course, there are some people with who are immuno. For instance, we have yearly HR complex. Pap smear is done.
Okay, thank you. So I want you to tell us, what do you mean by reproductive age group? Because I did remember talking about that reproductive age group. And I remember saying on ATP that women should have their babies between 18 and 35. Oh my God. And people came down on me. They almost tore me to pieces. Like, am I God? Am I saying that if you're 40, you can have a baby? Blah, blah, blah. So, at least I'm a pediatrician. So, I just want you to tell them what you meant by that.
When we say reproductive, ideally we say between 15 and 49, actually. But of course, we know that people in their 50s have had children. I mean, there's no whatever. The fear is that the older one gets, the more complications that may develop. And so you don't want a baby without a mother.
Okay. So it's not like you can't have your babies after 35, but we as pediatricians, I know the gynecologists don't mind you have your baby anytime, but we are the one that are going to take care of that baby. And we know that the risks of your baby having complications, having health issues.
We just want everything to be safe.
Yes, we want your baby. It is not enough. We don't want you to have baby later and then have a baby with a lot of disability that you have to now be dealing with. So we want you to have the babies early for the pediatrician's perspective. But of course, we are not saying you can't have baby after 35. All right. Thank you, Dr. Jumoke. It seems like you are freezing once in a while, but let's hope.
No, I thought you were the one freezing.
Oh, am I the one? Oh my goodness. Okay, so I'm the one freezing. Okay, I usually try to use two different internet when I'm on, so that if one is misbehaving, one can take cover. All right, sorry about that. Okay, let's move on. Are you still with me? Okay, I'm not sure whether I'm the one freezing or is Dr. Jumoke frozen. Who is frozen now? Are you with me? Dr. Jumoke, are you with me? Can you hear me?
I can hear you now.
All right, sorry. Okay, I think I'm not sure whether I'm the one or is your internet, but one of us is definitely frozen a little bit. Okay. I'm looking for the next question. Okay, yes, I think we've answered HPV and all that. Okay, let me go to Facebook and come back. All right. Facebook people, please, today is for the maternal health issues. So if you have any issues for your babies, please post it on our Facebook group. Okay, yeah. Owosheni is asking, hello doctor, what causes postpartum preeclampsia? And how can it be monitored so that it doesn't occur in subsequent pregnancy?
Okay, so preeclampsia.
Postpartum preeclampsia.
Condition. Okay, so postpartum preeclampsia just means that you develop hypertension and you may have protein in your urine after you have delivered. But it is actually the same cause, whatever, because preeclampsia can occur. It can be antepartum when you are pregnant. It can occur when you are in labor for the first time or after. So the cause is generally the same. And basically, again, how will I say, the prevention, it's just to take care of it. Whatever predisposing due to preeclampsia to postpartum would have happened when you were in labor or when you were in pregnancy. I don't know whether you understand.
Yes, we are following.
So it's and so basically is to treat and closely to be under control so that it does not progress to it can be occasions.
Okay, I think Dr. Jumoke, we're losing you. I guess your network, I don't know whether it's your office or because I know that your office is like, it's always the reception there is not so great. I think we lost you. Is it me or is it Dr. Jumoke now? I'm always confused.
ensure that.
Okay, I think the line was breaking so much.
That is the early on, generally speaking.
Okay, Dr. Jumoke, when you were talking, we seem to have a lot of breaks, and I'm not so sure we got all the information.
Okay, so should I start again?
Yes, please. It's better now.
Okay. All right. So what I was trying to say is that preeclampsia can occur at any time. So it can occur when you are pregnant, we call it antepartum preeclampsia. It can occur when you are in labor, we say it's intrapartum, and then it can occur after you have delivered. And I'm saying that the cause is generally basically the same. I don't want to go into details because it has to do with resistance within the vessels and some other things, and some things predispose to pregnancy. If it's your first pregnancy, if you're less than 18 or greater than 35, if you're carrying twin pregnancy, all these ones, if you're a known hypertensive, you should have. So basically, if we know that the use of low dose aspirin with twins, well, then and you get you had preeclampsia before it, then to place you on low because that the use of low dose early you from time to time checking your blood pressure, checking other parameters to ensure that it doesn't happen.
Okay, Dr. Jumoke, I think you are the one breaking. Do you want to come off and come back again? I don't know whether that will make it better.
Okay, let me see whether I'll change my location.
Yes, I think I don't know, the last time you were in your car was perfect. Maybe because it's outside.
No, it's not outside. I'm actually in an office. I'm still in the office. Okay, so let me try this one. But because going outside with other people, I will not wear mask.
Oh, that's true. It's okay. It's okay. Let's just find. Yeah, sometimes it's perfect, and sometimes we just kind of lose you. Sorry, I know it's always our challenge with mobile network in Nigeria. Okay. Anyway, bottom line, the question is that Dr. Jumoke said your doctors can prescribe low dose aspirin for you, and then they just make sure you are with the gynecologist and obstetrician for those kind of things, and they can deal with it. Okay, Dr. Jumoke, are you with me now?
Yes, I am.
Okay, let's hope. Okay, good. Let's hope the internet behaves. We manage. We soldier on. Okay, Zoe is asking that, good day, doctor. Please, when a mother has low blood counts, does it affect the child too?
Oh yes, it does. It does. Because low blood counts, or we call it anemia. That means your blood level is low. It's called anemia. We know that when a mother has anemia, it can affect the baby, the unborn child. Because you remember that the mother is the sole person providing everything for the baby. Okay? So, and we know that blood cells, what do they do in the body? They help to carry oxygen to different parts of the body. Okay? And then we need oxygen to function. All the cells of the body need oxygen to function and to grow properly. So if, for instance, the mother's blood level is low, then it's going to affect the baby because it affects the baby's weight. It can cause a low blood weight baby, make the baby small. Apart from that, it can also cause preterm, predispose the mother to preterm delivery. So when your blood level is low, we don't like it. Also, it can also cause you may not be able to tolerate blood loss when you deliver, right, and make it worse. Okay, we call it postpartum hemorrhage when you bleed excessively. But if you are starting from a very good result, it will not affect you. But if your blood level is already low, a very small amount of blood loss will affect you generally. So blood, yes, having a low blood level will affect your baby most definitely.
And so
That's why in this environment we routinely give mothers blood medications, blood building medications to help you build up a good blood level.
good. So if somebody is blood level is low already, so what should they do?
Okay, so it depends on how low. We have the mild anemia, we have the moderate, and we have the severe. In mild to moderate cases, you just encourage the woman to eat very well, or eat a lot of iron-containing supplements, and you give her, we call them hematinics, your iron, your folic acid, and vitamin C. We usually add vitamin C because it just helps to build. So the things we normally check for is when you are not symptomatic, we are not encouraged to transfuse you. Also remember that blood transfusion, we have a lot of risks involved transfusion. Apart from the transfusion reaction, there could also be risk. We know that most of the blood are well screened, but you know that there's also a small risk of having infection, blood-borne infection. So you are not in a hurry to transfuse. So the thing about it is that when people when your blood level is low, we ask you questions. For instance, do you get tired easily? Are you able to tolerate work? And you start noticing that, oh, I just do small work, I'm already exhausted. We check your pulse. Is your pulse getting is it getting fast? Is your pulse fast? Is the higher than normal? Is it that when you lie down, you can't even lie down properly, or you feel your heart racing when you are not afraid? All these signs are telling us that, oh, you are not coping well with the low blood level, and we have to keep your blood transfused you. So, but if all those things are absent and you can tolerate you, we usually will tell you build up, we'll give you the pebble, the folic acid, and check it every 2 weeks. You understand, to see that your blood level has started increasing. Also, apart from checking it, we want to find out why you are having it. Okay, so we screen for other things, infection, common things here, malaria, for instance. If a woman has malaria, it can cause low blood level. We want to find out you don't have any form of infection, you don't have parasites in your stool, okay, causing sucking the blood and depriving you. So we do certain tests to make sure that we try to find cause. Sometimes even with having just a blood film, all right, apart from checking your blood, we do what we call a blood film to find out the type of anemia it is. Is it iron deficiency? Is it B2 deficiency? Because it can point out and can replace whatever deficiency it is. And if it's as a result also of nutrition, we also advise you to improve your nutrition.
All right, thank you so much. So those on Facebook, I hope you can hear Dr. Jumoke. Just let me know in the comments you are hearing her perfectly well, because I know you're only seeing me. She's on the Instagram, but I'm sure you can hear her as well. So she has told you what to do. So the Shokefu is asking, hi doc, how can one undo high blood pressure and anemia in subsequent pregnancy? Okay, so it seems like people have a lot of concern about high blood pressure, preeclampsia, and anemia. So she just finished answering the anemia question, so we're not going to repeat that. So I hope you listen very well, which I can summarize to say you have to see your gynecologist, obstetrician. They can give you blood tonic and whatever is necessary, and they can also find out the cause of the anemia and they can treat it. And if you're already having signs that the low blood level is really affecting you, then they may need to transfuse you. But of course, that will be the last result. So, but Dr. Jumoke, can you address the high blood pressure question? So, how do you handle high blood pressure in subsequent pregnancy?
What she didn't clarify was that is it that high blood pressure that occurs in pregnancy, or high blood pressure because the person is a known hypertensive?
Okay, so
that's where. Okay.
I wanted to know whether she should update the question or you want to just answer the truth. So your high blood pressure, is it something you have before you were pregnant, or is it something that happens only with the pregnancy? So I think let's assume it's something that happens only with the pregnancy, because and answer that. I'm sure that if she has high blood pressure before pregnancy, she may already be on treatment anyway.
Okay, so I want to do the two sides.
Okay.
Okay, assuming that the high blood pressure is, the person, she's a known hypertensive, and that's why where the issue of preconception care takes place. Unfortunately, we don't really have this care, and it is not so popular here because before a woman, ideally, pregnancy should be planned. Okay, it should be planned to say, okay, now this is the time for me to get pregnant, and you have what we call preconception care, because you just want to check yourself to find out that everything is okay with me so that I can get pregnant. Okay, so for instance, if someone is a known hypertensive and you are not getting a good control, that is the time to have a good control of your blood pressure before you get pregnant. However, you find people that are even known hypertensive, they get pregnant at any time and then will start battling with blood pressure control because was not good before. The same way even with the anemia. Okay, if the blood level is already low before pregnancy, you already start building it up. I need to say this, that because of the changes that happen in pregnancy, the blood level goes up and the blood volume doubles and increases generally. We have what we call physiologic anemia as a result of changes that happen in the body as a result of pregnancy and pregnancy hormones. So, but for instance, when a woman does preconception care, they can detect early that, her blood level is low. She may have been, on the borderline before, then she gets pregnant, all the changes happen and the blood level drops lower. But when you have preconception care, you're able to pick these things and we're able to correct them before you get pregnant. However, in the absence of that, when you get pregnant, that is why when you book for pregnancy, when you register, you take all these parameters. You do your blood level check, which are routine tests you do. The reason why we're doing, want to know where you are starting from, because if you're already deficient, you know how to work towards it. Okay, and apart from that, you check your blood pressure to find out that it's okay at the time we're meeting you. And if you have history of hypertension in pregnancy, we're told that normally we routinely monitor your blood pressure. But usually, the hypertension in pregnancy doesn't usually start until after 20 weeks, because you know that the normal physiology of pregnancy, it reduces blood pressure in the first half of pregnancy, and after some time, blood pressure starts climbing. And that's why even people that are known hypertensive, sometimes they play around with their drugs in the early, in the first trimester, nothing happens, because at that time, blood pressure drops because of all the changes that happen. So it is for you you may not be able to prevent elevated blood pressure, but it's for you to, first of all, ensure that when it's elevated, it is well controlled. Elevated, it is well controlled. And if you have the anemia, to make sure that intervention supplements are given early enough that you won't need blood transfusion over time. But if, for instance, you are booking late, you register for antenatal at 30 weeks or 31 weeks, and they are now giving a PCB of 26% or 24%, you have a very short time from that time to delivery. You may not be able to build up that PCB very well, as opposed to if you had a PCB of 24% and you were just 8 weeks, then you have enough time with oral supplements to boost your level.
All right. Thank you so much, Dr. Jumoke. So thank you for those on Facebook that told me that they can hear Dr. Jumoke live and direct. That's very nice. Okay, so I say for those who have questions about health issues that pertains to babies, please just post your questions straight to the Facebook group and we will answer it. Today we just want to do mothers' health issues because I don't get to see Dr. Jumoke every day to answer your question. And so now let's go on. Sorry? Yes, so we need the mothers to be healthy to take care of babies. Okay, so Kemi Adetokunbaja is asking such a long question. I will advise that when you're asking question on our group, try and keep your question short and straight to the point. Avoid going into too much details so that we can just concisely answer your question. Okay. So she's saying, good evening, doctor. What could be responsible for monthly severe pain before and during menstrual cycle? So I think she's asking about what do you call it now? Dysmenorrhea. I forgot. It's a long time I've done angina. Okay, and then she said that it's been on like 4 years after delivery of my third son through CS. I've been to the hospital. Have been treated for infection. I've been treated for infection, but the pain persisted. I went to another doctor who said it's endometriosis. But last year, another scan was done. I was told my cervix was too short with my womb, that is what is causing the pain. And my question, I can't even see your question because the Facebook server has cut it off. So, anyway, the bottom line is what is causing severe pain. Obviously, it's something that she was not having before a baby, a third baby, which she had through CS. So she's gotten this different kind of feedback from different professionals. So what is your advice for her?
All right, so basically, when your period becomes painful, call it dysmenorrhea. There are different types. We have the primary and the secondary. Primary dysmenorrhea, that's ever since you started menstruating, you've been having the pain, and it's usually the cause is unknown, and usually it tends to get better after delivery. Okay. However, we have secondary causes. The dysmenorrhea is as a result of certain things. For instance, endometriosis. Endometriosis, which means that you have the lining, the tissues within the cavity of the womb is in other places where it should not be. So what happens is that once you bleed, you see your period, you bleed in all the other areas where you have the endometrial tissue or the tissue of the lining of the womb, and these are cause very severe pains. Also, when you have conditions like fibroids, it can cause painful periods. And when you have also infection, you have pelvic inflammatory disease, for instance, this can also cause infection. So the most important thing is to try and find out why you are having this pain. All right. I think you need to see a specialist. Sometimes they may do what we call a scan. A scan may show certain things, but if the pain persists and they can't find it, they have to do what we call laparoscopy, where they just pass a camera, make a small incision in your womb, and pass a camera to look into the structure, your pelvic structure, look into your uterus, look at your ovaries, look at the surrounding structures to find out is there anything causing it. Sometimes when you have very severe lesions too, all right, scar tissue, scarring of the tissue, it may cause it. Well, it may not be unconnected because you were not having it and you delivered by cesarean section. You don't know how when the CS was done. Did you have complications after the cesarean section? It's hard for us to tell. But it's very, very important for you to see a gynecologist who will sort you out. Because you need to first of all do a scan, you need to be examined, and if you cannot manage it, what we normally do is to give painkillers. Usually, you give painkillers and you start maybe a few days before the on the period, and then sometimes the painkillers may not do justice to it, and you may have to do laparoscopy because if the pain is severe enough to affect you, maybe some people when they have their periods they cannot do anything at all. They are at home, they are in and out of the hospital, they are tired of even using painkillers because sometimes they now have gastritis because they use all these non-steroidal anti-inflammatory drugs for a long time, and so you may have to do laparoscopy to look at it. And excuse me, if they find any endometrial deposits, they may remove them or may free certain adhesions and the person gets better. But you need to see for a gynecologist for him or she.
Okay. Now she says something towards the end of her question about her cervix being sold to her womb. I mean, your cervix is part of your womb, so there's no way they can be sewing your cervix to your womb. So please, when people give you those kind of information, it automatically means that they are not qualified professionals that are telling you those kind of information, because the cervix is the opening. Is the opening of your womb, so it cannot be sewn onto what it's already part of. So I think you should see gynecologists, specialists like Dr. Jumoke. And I always tell people when we do have this kind of program, please, not everybody who you see who claim to be a specialist is actually a specialist. Okay, so many people tell me, oh, I saw a pediatrician. Oh, the pediatrician told me that my baby's problem is due to teething. That person cannot be a pediatrician. I don't even need to know because so. But as those of us that go to the hospital, we just think that when somebody is seeing a child, the person is a pediatrician. When somebody is seeing a woman, the person is a gynecologist. That is not true. And if you are not sure, it's better you go to hospitals like these teaching hospitals or government hospitals where they have tertiary level of care, because those hospitals, they have the what's it called? They have the specialists they have in those hospitals. You can be sure they are real specialists. So please be very careful who you see. Oh, my phone is almost dying. I hope it will survive. Okay, so let's move on. Let me quickly answer a question on Instagram because I don't know whether we have any question on Instagram. Okay, I asked a few questions on Instagram. Then we'll come back to Facebook. Okay. Nikki B is asking, is it normal to see your period exactly 6 weeks after your vaginal delivery?
Okay, so you can see your period at any time. Of course, you know about breastfeeding. It depends on what you do. Okay, so if you practice.
Oh no, I'm losing Dr. Jumoke.
Mixed feeding. Can you hear me?
Hey, okay, I can hear you now.
If you're doing mixed feeding, then you may see your period earlier. So then it's not sacrosanct that you must see your period 6 weeks exactly. 6 weeks you can see your period, 8 weeks you can see your period, depending on your own state and whether you are breastfeeding exclusively or not, or what your pregnancy period was like. So it's okay if you see your period 6 weeks after, it's not abnormal. However, once you see your period, you also know that you can get pregnant. So if you don't want to get pregnant, it's also advisable to do something.
Yeah,
but pregnancy using family planning.
Yes, and that reminds me of somebody that asked a question like, she went to the hospital for family planning, and they told her that as long as she's breastfeeding, they cannot do a family planning for her, or whatever. I was like, who is telling her that? So I just wanted to speak to that because a lot of mothers get this wrong. Or I don't know whether it's the people that are working in those places that seem to think a mother who is breastfeeding who has not yet seen her period. No, that's the other hand. The question is that she has not yet seen her period. And because she has not yet seen her period and she's breastfeeding, so they told her that she can't do family planning. What is your own opinion on that?
Of course, that is not true. That is not true. Usually, we normally just give the 6 week period because we just say, okay, when you come for your postnatal visit, it's a good time for you to also do family planning. So it is not because it has nothing to do with not seeing your period. Once it's 6 weeks, you can do your family planning. And the reason why we just wait sometimes 6 weeks is just ideal because that's when you are officially out of the postpartum period, but it has nothing to do with seeing your period or not seeing your period. You don't need to see your period to fix in, for instance, your coil. You don't even need to see your period to fix and do any family planning. The only thing is that when you don't see your period, maybe it's been 3 months or 4 months post delivery and you haven't seen your period, when you put in, for instance, the hormonals, you need cover because some people we want to say, okay, just wait a bit for 7 days because we don't know what's the cycle you are in, and we don't want to be in a situation where by the next day or 3 days you started having intercourse. Let me have started. So we want to be sure that the hormone is in a certain level in your blood, and make sure that you are covered. The contraceptive effects of your device have started taking effect. Okay, so you don't really need your period.
Okay.
For that. Get what the old school way of thinking that we cannot rule out pregnancy. What if you are pregnant? So I guess
that's the way it's coming from.
Yes, I want to believe that's where it's coming from. That would not see the what if you are pregnant and all that.
Yeah. Okay. So, but at least now you know better. So, Dr. Jumoke, I also sent you the link to the StreamYard in case my phone goes off. then you can join me on Facebook. But because I'm charging it, but I think it's too hot and it's not really charging effectively. But let's just continue. But just in case we go off on Instagram, just join me on Facebook. I sent you a link to join the live stream on Facebook. Because that one is on the laptop, which is fine. But I'll quickly take all the Instagram questions just in case. All right. Yeah, okay, so we've answered Nikki B's question. Okay, the next question here says, Kosi once said, my blood pressure was not high, but about 36 weeks it went high to delivery, and now my baby is 5 months and it is still high. What should I do? I was given Adomate drug. What should I do?
Okay, so nothing you should do. You are now hypertensive.
Oh.
Because usually if it's associated with, unfortunately, when it's associated with pregnancy, we say by 6 weeks it should go. Sometimes the Americans, depending on which school of thought, the Americans will say 12 weeks, okay? Post delivery, everything should have resolved. Okay? So if after 5 months it hasn't resolved, then it means that you are a known hypertensive, and then you should see your physician and let them do the needful. You definitely have to continue all your drugs. Now, being hypertensive just means that you need medications to maintain a normal blood pressure. Because most people make that mistake of, once my blood pressure is normal, they just stop taking medications. It's not right, because but I checked my BP. Yes, that means the drug is working for you, because you may be on medications and your BP is not controlled. Now, if you're on Aldomet, I don't know, maybe Aldomet and ibuprofen, then it may be better for you to see a physician. You may have to review it. And newer antihypertensive that work excellently well. But they were probably given Aldomet because it's pregnancy friendly. Now you are no longer pregnant, so there are other options you can use. All right. So if Aldomet is not doing the job, your medications need to be reviewed, and then you are hypertensive.
Yeah, and I think let me just okay, and let's just remind ourselves at this point that when you have your babies, that is not the end of your care by the obstetrician and the gynecologist. Many women don't go back for any follow-up. They don't go back for nothing. And that is not right. Like now, you should have seen your gynecologist after 6 weeks of having that baby. And if they know that your blood pressure is still high, I'm sure they would have been the ones telling you to go and see maybe the physician. But many of us don't go back for that checkup. And that is why we just keep on continuing the same drug, the same treatment. No, you really need to go back. Even if everything is fine, you should still go back. You must see the gynecologist for your 6 weeks postpartum, and you must see the pediatrician for your 2 weeks after your baby has been born for baby check. And you must see us at 6 weeks for your immunization and all that. Please, it is important that we go for all these checks so that we avoid story that touch. Anyway, Oluwakemi is asking, is headache during or after a period normal? And it sometimes won't go away even if you take analgesic. So is it normal to have headaches with your periods?
All right, so you can have headache is a non-specific symptom. I mean, there's 1,001 things that can cause headaches. Okay, and sometimes some people have what we call premenstrual syndrome. Just before your period, you may start having maybe headaches. You may have mood swings associated with the hormones. Okay, so and this can even further occur during your period. Okay, but the most important thing is not to just associate it with your period. It's better for you to rule other causes of these headaches, these persistent headaches, than to assume that it's it's period related. Better for you to have a check to say, but this is okay, we've done the necessary things. I can't see what is causing the headache. Maybe it's just these hormonal swings and all that. So I advise to thoroughly treat rather than assume. Because for you to say it's as a result of the period, it has to be a diagnosis of exclusion. You have excluded all
other causes.
Any other thing that can cause headaches.
Yeah.
And just to assume that that's a result of your period.
All right, thank you. Oh my God, our time is running fast and we still have so many questions. Okay, this mom is asking, what can you say about back pain after CS delivery? especially at the point where anesthesia was administered. So I'm assuming you have what we call spinal anesthesia, and the pain is still coming on and off. But you didn't tell us at what point it is after this year's delivery, because so I always say it's better to always give us timeline. Obviously, you are going to have pain the day after that procedure. It's a procedure, but if you are still having the pain, maybe like 1 or 2 weeks or 6 weeks after, it's a different thing entirely. So I don't know what Dr. Jumoke wants to say to that.
Well, it's a complication of spinal anesthesia because you may have headaches after, you may have back pain, maybe the infection may set in. There are no thing to do, like she said, if you're having it a week or 2 weeks after, is go back and complain to them, and they will be anesthetists who know what to do, because that could be a complication of the spinal anesthesia. But rightly, as she said, you should have told us the interval. Okay, is it was it? We just had it now, is 1 week or 2 weeks post your delivery, and you're still having the back pain. Also remember that the delivery also comes, so it can be a result of the anesthesia. It's a result of your new chores that you're finding yourself bending, doing all of the activities in your back language. So we just have to find out. But ideally, because you've had a spinal, it's better for you to go back to turn. If it's just within a few days or weeks, yes, but if it's like, oh, you got delivered, this is 3 months, 4 months, we had better start looking for other causes as well of the back.
Okay, and may I remind you, like, we get a lot of questions, people asking us about, so they've done a procedure and they have issues and they keep coming to ask. So the best person to ask when you have had a procedure for any issues that you have is the person who did that procedure, is the surgeons and only the surgeons. So it is better you go back. That's why they always have what we call follow-up. Some of us think that once we have had the procedure, that's the end. No, the person who did the procedure can still see you after and give you advice. So even if it's a procedure for a child, whether surgery or anything, the person who did that procedure, any issues after that procedure is that same person that you, because the person may know other things that went down during that procedure that we don't know. So it's better you always go back to them. All right. So now let's quickly answer the another question. Somebody is asking whether eye platelets is associated with pregnancy. Eye platelets, is it associated with pregnancy?
Not that I can remember.
Neither here nor there. Yeah.
No.
Okay.
Not that I can remember. No.
Okay, so let me quickly go back to Facebook. That I can see a question about augmentin and measles. Please don't. Augmentin is not to be used at all if a doctor has not prescribed it. And measles is a virus, so it should not be treated with antibiotics. There may be reason why we use antibiotics. For example, if there's another complication, pneumonia, another, but let's all get into our mindset that antibiotics is not something you walk and buy by yourself. It must be prescribed by a doctor. You are doing yourself more harm abusing antibiotics without prescription. All right, but let me just quickly go. I just can't resist myself from answering that question because it's a pandemic in Nigeria. Okay, so Zainab is asking from Facebook that I put to bed in December 2018, saw my period in January 2020, but since then my period has not been flowing well. Can use a pad for a whole day. Even till I use the bathroom, the blood flows along with the urine. Is there anything to worry about? Dr. Jumoke, did you get that question?
No, I didn't. Can you start again?
Yeah. So she had a baby in 2018 December, and then she started her period in January 2020. So a year after or thereabout. But her period is not flowing well, like it's reduced, like she can use one pad for a whole day. So there's a reduction in the blood flow. So she's just wondering whether it's something to worry about.
Okay, how did she deliver? Was it normal delivery?
So you didn't give us enough information, and you didn't even tell us whether you're also on family planning. There are many reasons why you could be having this. So you need to give us more information, or you may want to see your doctor so that you can, because if, for example, if you're on hormonal or hormonal contraceptives, you won't see your period regularly. That's a given. Anyway, so you may want to update your question How did you deliver? Are you on any form of contraceptives and all that? What is your normal period before? What is it now? So Dr. Jumoke have a contest. All right. So somebody say I gave birth 3 months ago, but I've been having generalized body pain. So Dr. Jumoke, that's the question.
Okay, so I don't think that one is generalized body pain to be as a result of anything.
It could be from your care of the baby.
Do you have help? Yes. Do you have help? Too much work, the chores, the new status. Even if you are not in test time more, nursing a child is demanding, it's quite demanding. So
A lot of
just
work.
as a result of a lot of work. If it's just body pains, no fever, no cough, because you know what's flying around right now. You also have to know that it has nothing to do with that. But, I mean, if you're working hard all day and you have no help, you have other children to take care of.
Yeah.
Maybe fatigued.
So get all the help you can. I always tell new moms that you can't have enough help. Any help available, just take it. All I want you to do is to breastfeed your baby, actually, and let every other thing be done by other people. All right. Okay. Chiamaka is saying I gave birth 3 months ago, but okay, you are still the same person. Okay, I think we've answered your question. So Chiamaka, it seems like you are getting overwork, or you may even be sick. Nothing stop you from having malaria or any other thing else. So you may want to see your doctor first and be sure there's nothing else. Okay, somebody is asking about this question. I'm not sure whether it's the same question, but it seems like we've answered this question about rise in blood pressure and headaches when on period. Okay, no. This is a different one. He said, please, doctor, what can cause a rise in blood pressure to the point of having headaches whenever I am on my period? I had history of preeclampsia in my pregnancy, but the headaches goes without any medication. I've been experiencing this for 6 months now. So I'm just curious. Do you normally check your blood pressure during your periods? And is your blood pressure normal after your periods? Because it's very important. Because I hope it's not one of those people that Jumoke was saying you're already now hypertensive and you just think it's your period. So you really need to be careful that. But let me allow Dr. Jumoke to give a specialist insights.
It may be hypertension, because usually, I mean, the periods, there's nothing in the period physiology that will make your blood pressure high, except maybe you are unsure about other things around the time of the period. However, I think you need to take close monitoring, take a day, maybe Sunday or when you are not going, and measure your blood pressure every 4 hours for exactly those things. Because if given a history of preeclampsia, it could just be that now you are now hypertensive, and maybe it's the time of your period that you just take out time to take.
Maybe because she's having the headache, so she went to check her blood pressure. So please check your blood pressure even when you are not having headaches, even when you are not having your periods, because we really need to be sure that you're actually not having a hypertension itself, separate from the preeclampsia. So it's very important, because a lot of us walk around with a lot of high blood pressure and we don't even know it, and it's a silent killer. So the earlier the better. I can see another question popping up on Instagram that she said, I've never experienced high blood pressure, but since I gave birth to my third child, that is 11 months old baby, I have been having 140/95. 11-month-old baby, 140/95.
So you are hypertensive. Remember that you never experienced it. You are now older.
You are older.
Have 3 children. You are definitely older. I want to believe it depends. If you have 3 children and they're well spaced out, most likely you will be 35. Okay, so you are older, probably added more weight, and you probably are stressed up.
Yeah.
As well, plenty stress. All those things can contribute to the development of higher blood pressure. So it has nothing to do. Remember that with age, the risk of having all this hypertension, diabetes also increases. So it has nothing to do with childbirth.
It has nothing to do with your 11-month-old baby. We think you are having hypertension, and you really need to see your own doctor, a physician, not a gynecologist, not a pediatrician, a physician. All right. Okay, let's go back to Facebook. Moses is asking that when is the right time for the menstrual blood flow to start after delivery? So when should they expect the blood flow? Some women are so very interested in seeing their monthly flows. I'm always worried. I'm always like, why are you worried? I don't miss my period.
Like I said, it also depends on a lot of factors. Number one is whether you are
Breastfeeding.
exclusively breastfeeding or not. Of course, when you are exclusively breastfeeding, it's going to be later than sooner. But you can see your period anything from even 6 weeks post delivery. For some people, especially when you don't breastfeed exclusively. So there is no normal or sacrosanct time you put to say you see your period. For instance, some people may not even have normal regular periods before
until they stop breastfeeding.
And for such people, their periods are not going to be regular. They may take about 1 year. That is not abnormal for them. Also, if, for instance, you put them insert or do some form of family planning that would you will not see your period, just flow. So there, you have to look at the circumstances around. However, if, for instance, you are not breastfeeding exclusively, you are not on any form of family planning, and after a year you are not seeing your period, then of course you should be worried.
Okay.
Why is my period
Yeah, that's a long time. Okay. Because let me just ask that question, because I personally don't worry if I don't see my period and I know I'm not pregnant. But some women really, they just want, like, I have one of my friends, she just wants to always have that regular, like she wants to see her period every month. So what is your suggestion for them? Even some of them, when they are breastfeeding, they say ask us that question, and I always say that if you're breastfeeding, don't worry about seeing your period. But some people are not comfortable, like they are not having the regular period. They always want to be sure they're having it. Some of them panic that maybe that means maybe when they want to get pregnant, they may struggle getting pregnant. I just want you to address that issue, because I think it's something that creates a lot of anxiety for many mothers, especially. What's your view on that?
Well, we just mentioned, so it depends. If you're breastfeeding exclusively, please do not even worry your head at all. Don't worry your mind. If you put in certain form of contraceptive like the ICD containing hormone, or you put in an implant containing a hormone, your period may be erratic.
Yeah.
All right, so you don't have to worry about that. And like I said, also if your periods have not been regular before, people with polycystic ovarian syndrome, for instance, that their periods have not been regular, they're just going through, because sometimes you may have 2-3 months of new periods. And then when you now deliver, remember also things like stress can make period absent. And that nursing period, for some people, they don't have health and they're really stressed. A lot of hormonal imbalance here and there can affect your ovulation. Okay, so like I said, I would not worry if you've not seen it 3-4 months after you've delivered. I won't even worry 6 months, even 9 months. It's when it's like a year that you're like, oh, you have stopped breastfeeding, you don't have as if I'm using any hormonal contraception or contraceptive that affects. So why am I not seeing my period? Then we can start.
They can see you.
But if not, I don't think we should start worrying.
Okay.
But even the not sleeping, all those ones can affect all your period. It will just affect.
All right. Thank you, Dr. Jumoke. Please, good evening, doctor. Please, what causes water to leak? I guess you mean leak, like LEAK, at 34 weeks of pregnancy. What makes water? What makes a woman to start leaking water at 34 weeks?
Okay, leaking water at 34 weeks means that you have broken your water. Okay, there is a sac that encloses both the baby and the amniotic fluid, and sometimes if there is a defect in that sac, it will leak water. Okay, and we say you have ruptured your membranes. So sometimes it may not gush out. You just find out that you are wetting yourself. As not as if you know about it. I mean, it's involuntary. Just find out you are staying and it is an indication for you to pack your bags, go to the hospital and get yourself examined. Okay. Usually when it happens prematurely like that, we always think it sometimes it's linked to infection. Okay, that there are a lot of processes that cause that now causes that leaking water. But if you have that, number one, you need to see your doctor to confirm that it's actually amniotic fluids that is coming out. And then depending on the age of the pregnancy,
34 weeks.
If it happens at 34 weeks, the aim is to manage conservatively, to try and push pregnancy to be a bit advanced However, we know because you want your baby to be mature enough. The most important thing the pediatrician is here is maturity.
We are happy at 34 weeks. The lung is mature at 34 weeks. Let that baby come out.
On the average, we know that the Africans long tends to mature at 34 weeks. However, on the pediatrician side, we still want to give steroids to help because we're in this environment and we've seen things happen. So just want to push the baby as long as possible. But if you truly open your water, you know that within a week or two, the
baby is coming out.
Okay. And then you need to in the hospital environment. Sometimes in a manager on outpatient basis, it is not much, and they are closely monitoring you, ensuring that you don't have a fever, your pulse rate is not high, you are not having false smelling vaginal discharge, anything that will point to infection. Once any form of infection sets in, we have to deliver you as early as possible because of all the risks associated with that. To the mother and to the baby.
Yeah, thank you, Dr. Jumoke. Oh, okay. Yeah, sorry to cut you. I didn't know you finished. Okay, but I think the most important thing I really need to sound to the mothers, because some people see those things and they ignore it. Please don't. If you leak water at any time in pregnancy, don't ignore it. Please go to the hospital, pack your bags and go to the hospital and let the doctors be the one to decide what to do. Because if you don't, you may eventually have your baby boy, your baby may be compromised, and we the pediatricians, we are the one that will have to now start backing over that baby. We want your baby to deliver after 37 weeks. That is our prayer and that's our goal. But if you leak water at any point in time before that time, please don't ignore it. Make sure you find your way to your hospital straight away. Okay, Dr. Jumoke, somebody, Ike are you still with us? Thank you.
Yes,
okay, thank God. The internet is behaving today. So Ike is asking, good evening, sir. Oh, I think we are mass. Okay, so please, for someone who has battled with PCOS. PCOS, for those who don't know, is polycystic ovarian syndrome, and finally got pregnant, sir. I think, ma. Does the PCOS affect the mother or the baby in any form? Anyway, I think she's just basically asking, having polycystic ovarian syndrome and pregnancy together, what are any issues for the baby, any issues for the mother?
Well, for the baby, I'm not aware of anything.
I'm not aware.
It can translate to what basically people with PCOS, sometimes the miscarriage rate is high, sometimes, and that has to do with your weight. If you are on the obese side, the PCOS, it can increase the risk of miscarriages. However, we also know that those with polycystic ovarian syndrome are at risk of having what we call gestational diabetes. Okay, they are at risk of having diabetes later on in life, and they are also at risk of having gestational diabetes. And there are such patients normally recommend that they have what we call oral glucose tolerance test. Sometimes you may do it when you register, and that's about 28 weeks, because most of the hormones released in pregnancy help to push blood sugar out, and it helps because you are also feeding the baby. The baby needs, okay? So what happens is that when you cannot even handle the blood sugar, as the hormones, you will say the pregnancy hormones are diabetogenic because it just wants blood sugar to be so that baby can feed on it. But just know that with the polycystic ovarian syndrome, you are at risk of having gestational diabetes. So the doctor will watch out for it. And of course, when the woman somebody eventually develops gestational diabetes, that means diabetes occurring for the first time in pregnancy. It is not well controlled. It can affect the baby. The baby can become the blood. The baby can have hypoglycemia, low blood sugar when the baby is born. Can have polycythemia and can predispose to neonatal jaundice. So those are the things that can affect the baby as a result of gestational diabetes. But basically, those are the two things that can happen with polycystic ovarian syndrome.
All right, thank you.
Usually, they will have normal pregnancies. Okay. So the doctor should just look up for screen for certain things because they're at risk of certain things. That's all.
All right. Thank you, Dr. Jumoke. Okay, let me go back to Instagram and I'll take some questions quickly in case my phone decides to pack up. All right, I don't want you to feel bad. Okay, I've answered the question. So about measles, we're not taking questions. If you have questions about your baby, please post it on our Facebook group. And Igona is asking, is a weekly check of blood pressure for someone who have no blood pressure history okay? Okay, so I can answer that for you to say you need to have what we call regular checks at least once in a year or so. Check your blood pressure. If it is normal, you don't need to check it every week. But if it is high, you must check it again within 24 hours. And if it is still high, then you need to see your doctor. And every opportunity you get to be in a hospital setting, let them check your blood pressure. If you go to hospital for a cough, for a catarrh, let them check your blood pressure, but you don't have to check your blood pressure every week. The weekly check or daily check is for those who have confirmed hypertension and who need to monitor the blood pressure. Now, let's go back to Faithfulness is asking, we want to know so that we can, if we can prevent another pregnancy, since it is difficult to track if menses does not start. Okay, I think you are responding to my issue about why do you guys want to be seeing your period. Okay, so you want to know in case you get pregnant, no problem. So you can always go for a pregnancy check. So you don't need to see your period. You can be pregnant without seeing your period. That's the point I want to clarify. So saying that you are seeing your period or you're not seeing your period means you're pregnant is not, is a very, it's a very what do we call it now, very subjective thing. You can be pregnant without having ever seen your period. So if you're thinking you're pregnant, you have other symptoms, you must go for a pregnancy check. So but anyway, I understand your point, and I think Dr. Jumoke already addressed your question anyway. Femi is saying, can I ask a question outside the topic? Please don't, because we can only get Dr. Jumoke once in a blue moon. So we want to ask all our health questions for women today. Okay, so Faithfulness is now saying, my baby is 1 year and menses have not resumed. Okay, but we've answered that question already. Okay, your baby is 1 year and no period. You have to go and see Dr. Jumoke and our colleagues now. If you have not seen your period, depending on whether you're on hormonal contraceptives or whatever, you have. I think the 1 year is what Dr. Jumoke says if you're cut off. Yeah. Okay. So I'm just trying to take all of them quickly so that we don't repeat because of our time. And I actually intend to breastfeed for 2 years as a form of family planning. Actually, breastfeeding for 2 years is not a form of family planning. Breastfeeding is not 100% foolproof. Oh. You have been lucky. Obviously, I think from what you said, your baby is already 1 year and you are not yet pregnant, so which is good for you. But make sure you do additional top of family planning because breastfeeding can disappoint you. But I guess at 1 year, you are good to go if you want to have another baby now. Okay, Femi Debbie is saying my baby, okay, breast milk, pap. Okay, so can you please post this on our Facebook group? I don't want to answer. I don't. Today is not my day. Today is for Dr. Chu. Okay, okay. I think I've taken all the Facebook, Instagram. Let's go back to Facebook. So Akinoye is asking, like, good evening, doctor. What's the effect of not eating well on my baby? I am 16 weeks. I get pregnant and I don't have appetite. And at what week can I go for gender check? That gender check, we'll talk about it today. But okay, a mother who is pregnant, 16 weeks, who is not eating, what are the issues? Is there any problem on our baby?
Okay, of course, if you don't eat well at the end of the day, you won't put on weight, and that can also affect. Although we say that the baby is an obligate parasite.
Parasite.
Remember, if you don't eat well, we also have what's called nutritional anemia, and with anemia will come low birth weight, preterm TB, pre and small. So we want you to eat well. Of course, we know that with pregnancy, people have swing. So occasionally, you may not. Your appetite may be good. For some people, it's really good. For some people, poor appetite, they're vomiting all the time and everything. If you find yourself vomiting, you're nauseated, you may have to go on admission, okay? Because we don't want you to start having issues. But if it's just that, your appetite is poor, we encourage you to take small but frequent meals. Right? Rather than maybe before the 3 square meals, you'll not be able to be sure you start taking very small but frequent meals. That will help you. And sometimes you should also take multivitamins, okay? At least to make up for the ones you are not having. But over time, your appetite should become better over time, generally speaking. For some people, it may just not return. Generally speaking, it will return as you progress.
Okay, so where can she go for the gender check? She wants to know the gender of her baby.
Okay. Gender check can be done even as early as 12 weeks. But then it depends on the expertise of the person doing the gender check and also the scan machine you use. So if you are using, for instance, like a Ford scanner, it can pick it up at 12 weeks. But generally, yes, you can pick it if the scanner is like 40. A good, very good scanner, you pick it even as early as 12. But however, it's around that 18 to 20 weeks that you can pick it. Sometimes for some people later, depending on the scanning machine. If you are using 2D, the very old type, you may not see well. If you don't have the expertise, you may not see well.
So, Dr. Jumoke, don't you people sometimes get it wrong? I think sometimes you tell us we're having a girl, then we get there and we have people.
I said it depends on the level of those two things, okay? Because when you have a 4D scanner and a very good person that is a pro in
specialist
selection by 18, 20 weeks, you will get it. Not the scans we have now. Or of course, sometimes the position of the baby may not make the baby backing you. Cannot see in between the genitals very well. It's also sign. So it's usually better, to tell the patient I'm not sure. And that's why sometimes they say, okay, come back at 28 weeks. But usually at 28 weeks, you should be able to see clearly because the baby is more advanced.
Okay, so 18 to 20 weeks, that's for you because it's already 16 weeks anyway. So Ike is updating her question. She was one that asked about the polycystic ovarian syndrome, and she said her question is that what should she look out for? And I think Dr. Jumoke already answered that because of your weight, you can look out for gestational diabetes and all that. But I think the most important thing is that please, I always prefer if you already have a complication history, don't register with midwife, don't register with just medical doctors, register with people like Dr. Jumoke, specialists, so that they can monitor you well. So they are the one that will monitor you for all these gestational diabetes and all that, they will plan. Usually most mothers who are PCOS having a baby, it's always a precious baby because sometimes conception can be hard for them. So it's better you are with this expert so that they monitor you very well. I don't like when people that have gone through a lot of stress to have a pregnancy, now have the pregnancy and it got messed up because you are going to church or you are going to a mosque or you are going to the traditional birth attendant. Please, some pregnancy should be with the experts, specialists only. Okay, thank you. I'm very passionate about that. Okay, somebody is asking Tony is asking what caused dizziness in the second trimester. She's eating well, she's taking her drugs, she's taking fruits, she's taking water, she's resting well. But once it is 12 noon to 4 p.m., we'll be sweating, we'll be tired, we'll be weak. What could be wrong?
Well, there's so many things that can be wrong.
Yeah.
But because dizziness is, anything can cause dizziness. So you have not told us, is it dizziness? Are you lying down and then all of a sudden you are the one, when you get up, you understand, you start feeling dizzy? Are you, because you have to visit vertigo, who is moving? Are you the one moving or you feel things around you moving?
Say she's sweaty. She's sweaty and tired. She feels sweaty. She starts to sweat and feel tired and weak.
Okay, so I think at that point you need to see your doctor.
The doctor sounds unusual. Yeah.
Check your blood sugar. Okay, is it that your blood sugar is low at that time? They say you are eating well and everything, but since being that period, let's check your blood sugar. Let's check your blood pressure. That is what we call postural hypotension, where with the change of position you may start feeling dizzy. So it's for you to be checked by a doctor so that we can rule out all these other things, so to check what are causes.
Okay, well, coming close to an end, we've almost gone 30 minutes. Normally it should be an hour, but I just like us to answer the question we have. Oh, somebody is asking us question from YouTube. Amazing. Finally, we got somebody from YouTube. Okay, Okoro Chizoram, I hope I got your name right. I gave birth 6 months ago, so my period 28 days later. No family planning yet, but my period is not regular till now. Some months, 26 days, 28, 30, 31. I'm a CS mom. I don't think that means your period is not irregular. I mean, Dr. Jumoke, you answer that one. CS mom, first baby. So our question is because of the days, like the interval. So some days it's a 28 day cycle, some days a 30-day cycle, some days a 31-day cycle. So I don't know. I think she's asking whether she should be worried or not because she didn't really say what her question is, but she's just worried about the irregularity of her periods.
Okay. So far, you are saying your period every month is not irregular. So 28, it cannot, sometimes it's not sacrosanct. It doesn't mean that it has 28 days, 28 days, 28 days. If it's between, it's usually a range. What we regard as normal is anything from 21 to 35 days. What we regard as normal. So if it's 28 days this month and it's 26, it's not bad. It's 28 days this month and it's 30, 31, not bad. So we are seeing every month is still within the normal range that we expected. So I won't have to worry.
So Okoro, what you are describing is not an abnormality at all. It's a normal thing. So it doesn't have to be exactly the same number of gap every month. Okay, Sophia is asking what can cause rupture placenta. You didn't tell us at what point this rupture placenta, but I guess it's after 28 weeks.
Is it rupture placenta or separation of the placenta?
Yeah, so we didn't know.
Because
so
if you really know that, we mean that separation of, is it separation of the placenta?
I don't know. She's asking us. I have a feeling she may be talking about abruptio placenta.
Yes, so elevated blood pressure can cause it. Sometimes trauma too can cause it. Okay, so that's the premature separation of the placenta. And of course, it's quite dangerous because it's very fatal for the baby. Placenta is what connects the mother to the baby. Okay, where exchanges are made. The ones the placenta separate prematurely, then it cuts off several connections the mother has with the child, and of course, it's going to affect the child. If it's not well attended to, it can lead to the death of the baby.
Okay, so I guess you have to provide us more information. Okay, let's just take the last set of questions on Instagram as we round up. Eboluwa is asking, is it normal to pass blood with feces during pregnancy? Please, what can be done to pubic bone pain during pregnancy? Did you get my question, Dr. Jumoke?
All right, so yes, it's not normal to pass blood with feces in pregnancy. However, because hemorrhoids are very common during pregnancy, hemorrhoids are just dilated veins and they tend to occur with all the changes in pregnancy. It can be very common. And if the hemorrhoid is very bad, it can cause bleeding. So first of all, you need to be examined by your doctor to confirm why you are having blood in your feces. Is it as a result of hemorrhoids? Is it as a result of something else? So you need to be examined. It is not normal for you to pass blood feces during pregnancy. Now, the pubic bone pain, okay, this is just a especially as pregnancy advances. Okay, so you just need to take it easy. Maybe the physiotherapist may have one or two manuals, which I cannot remember that will help you. But I mean, it's just part of pregnancy, and if you feel the pain, just go and sit down and rest.
Okay, so right. Thank you so much, Dr. Jumoke. Unfortunately, I couldn't really see most of the question on the watch party to be able to answer them, but I believe some of your questions are all similar, and I think we've been able to answer all of them. So I really want to say thank you at this point to Dr. Jumoke for taking time out of our busy schedule to answer all our multiple questions. Thank you so much. And I just want to know, for those of you who are pregnant, if you want to know more about pregnancy, some of you are asking what to watch out for during pregnancy, even before you get pregnant. Dr. Jumoke has a book that is out, and that is 9 months and beyond. So it's a book that detailed what you need to do before pregnancy, during pregnancy, after pregnancy, even the first set of care of your baby. I think it's a must-have for all mothers. So if you want to know, Dr. Jumoke, can you tell them how they can get the book, or if you, I can drop the link on as a comment.
You can also contact as a pediatrician.
Okay. Yes, just contact us, send us a DM. Send us a DM, send us a message, we will be able to send you the link to contact to get the books. I think it's on Amazon as well, right? Yeah, it's on Amazon, and if you want to get it like hard copy directly in Nigeria, then Dr. Jumoke may be able to arrange a delivery for you. But you can also get it on Amazon. It's beyond 9 months. Beyond 9 months, Dr. Jumoke Ogunro. Please go look out for it. And if you are struggling to get it, just reach out to any ATP on any of our platforms, and we'll be able to support you to get a copy. I think it's something you'll be happy to read. And I also contributed a chapter about the care of the newborn, so you're going to read more, of course. So you can read more about how to take care of the newborn in that book. I think it's something, and you can give it as a gift to those who are getting married, and they're going to have babies. So it's something, I think it's better you prepare ahead before you, so that you know what to watch out for. So get Dr. Jumoke's book. I'm sure you will love it. I think it's anyway, when you are ready, we'll tell you the price. I'm trying to remember. Let me not give you the wrong one before you now hold Dr. Baby to hold me down. Okay, so thank you, Dr. Jumoke, for coming, and thank you. So ATP, yeah, you're welcome. ATP Live comes every Monday from 6 p.m. Usually we say 7 p.m., but sometimes we're just enjoying ourselves. We can go a little bit above, but we're always here. And today I'm happy to have a specialist with me. Once in a while, I'm going to bring in specialists, so it doesn't become only baby breastfeeding, complementary feeding kind of thing. Of course, most time it's myself answering your health issues about your children, but once in a while, I'll bring other specialists to talk to other areas as well. So we always let you know ahead. Thank you so much for watching. If you mix it, you can always rewatch this video. We always keep it on our Instagram TV channel, and it's also available on our YouTube channel. It's also available on our Facebook group, our Facebook page. You can watch it over again. And if you still have questions, please feel free to post your questions to Ask the Pediatrician's Facebook group. For those on Instagram, we don't like to do DM question and answer. Please post your question on our Facebook group, and we will answer them within 24 to 48 hours most of the time. And of course, watch out for, if you prefer to be live, watch out for another episode of ATP Live next Monday. Most likely that one I'm going to answer all the pediatric questions. For those who are not happy with me now regarding answer your question, feel free to post it on the Facebook group or come again on Monday, and then we'll be able to answer your question. So thank you so much, everyone, and bye from me. Thank you, Dr. Jumoke. We'll call you again another time.
Knowledge for free. Thank you, Dr. Gbemisola, for having me.
Oh, thank you. Bye, Facebook.